Welcome everyone to today's webinar, and thank you for joining us. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We're looking forward to hearing your questions. Also, we will have 3 interactive polls throughout today's webinar. You can respond by selecting the poll answers directly on your computer screen. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. And now to quickly introduce myself. I'm Molly Gamble, Vice President of Editorial at Becker's Healthcare and Editor-in-Chief of Becker's Hospital Review. I'm pleased to be here to moderate today's webinar. To kick things off, I'd love to introduce our 2 speakers. Sheila Konepke has been the Vice President of Supply Chain for NueHealth since April 2014. She is responsible for all supply chain functions for 49 ASCs and specialty hospitals owned and managed by NueHealth. She is also responsible for the development of new facilities, ensuring all the equipment and supplies are available when a new facility is opened. Driving waste out of the supply chain has been a top priority for Sheila. Using lean methodology, she focuses on best practice processes to improve the efficiency of contracting, procuring, and stocking of medical supplies throughout the facilities. Sheila has over 30 years' experience in healthcare supply chain, with the majority of her experience in large trauma centers. A native of Montana, Sheila holds a Bachelor's of Arts degree in business from Metro State University in St. Paul, Minnesota. She also holds her Certified Materials and Resource Professional. Next, John Crowley has 20 years of healthcare experience with a variety of healthcare businesses, including psychiatric acute care, psychiatric long-term care, rural health, and surgical hospitals. Mr. Crowley has served in various capacities during his healthcare career, including CEO, CFO, compliance officer, and in-house counsel. Currently, Mr. Crowley is the Vice President of Finance and CFO and Compliance Officer for a joint venture surgical hospital whose primary emphasis is on orthopedics. John's current duties include oversight of accounting, materials management, patient access, revenue cycle, health information management, and clinical documentation, quality, and information technology. He is also the project owner for the Cardinal Inventory Management System implementation that is currently in process. Mr. Crowley's education includes a BBA in accounting, JD, and LLM in taxation, and he's currently completing an LLM in healthcare compliance. He is a member of the Texas Bar Association and the Healthcare Compliance Association. Now, let's cover our objectives for today. After this webinar, you'll be prepared to discuss the key challenges and emerging market pressures that ASCs and surgical hospitals face today, understand the role that distributors can play to help with these challenges, and describe the solutions that ASCs and surgical hospitals are using today to combat these challenges. Let's get started first by telling you about the experience Cardinal Health has supporting ambulatory surgery centers and surgical hospitals. To do that, we have Cardinal Health Marketing Manager Jamie Kelly on the line.
Thanks, Molly, and hello to everyone in our audience today. As mentioned, my name is Jamie Kelly, and I'd like to provide a bit of background on Cardinal Health before we jump into the panel discussion. With more than 40 years of experience, Cardinal Health is a recognized leader with a top ranking for transforming the healthcare supply chain to meet new challenges around costs, revenues, and outcomes. In particular, Cardinal Health is a leading medical surgical distributor for surgical hospitals and ambulatory surgery centers. Our ambulatory clinical team includes a group of perioperative nurses who average 20 years of OR and supply chain management experience. We like to think of these clinicians as a fresh pair of eyes for surgery centers and surgical hospitals to leverage in order to look at challenges in different ways and develop creative solutions to overcome each challenge. These clinicians have walked in your shoes and have seen the challenges you face every day. We're proud of the work this team does, and you'll get to hear how they've helped Sheila and John's organizations during the panel discussion, as well as ways Cardinal Health works with these customers to support their goals. With that, I'll hand it back over to Molly.
Thanks, Jamie. Now I'll ask Sheila and John to introduce their facilities. Sheila?
Thank you, Molly. NueHealth is one of the leading ASC management companies in our industry. We are growing with over 49 surgical centers and specialty hospitals nationwide. Our surgical facility operating platform improves the delivery of surgical services to millions of patients. We accomplish this by providing a comprehensive suite of tools, support, and management to improve efficiency and clinical and financial performance. Our facilities focus on orthopedic and spinal surgery and perform approximately 15,000 surgeries every month. NueHealth partners with over 2,500 independent surgeons across 30 states. These surgeons, for the most part, are the majority owners. NueHealth is a minority owner and the manager.
Thank you, Sheila. And John, would you tell us a bit about your facility?
Surely. Texas Institute for Surgery is a small, state-of-the-art acute care surgical hospital. We have 9 ORs and 9 inpatient beds and offer a full range of surgical procedures, including orthopedic, spine, ENT, pain management, urology, cosmetics, and ophthalmology, all with ancillary departments, including an ER. We perform 800 to 1,000 surgeries per month, have 60 actively admitting physicians and about 300 on staff. Our facility is jointly owned by 40 physicians and Texas Health Presbyterian Dallas.
Thank you both for telling us about your facilities. And now let's turn our attention to the key challenges you're facing today. So before we hear from our panelists, I'll ask our audience to share their challenges. Our first polling question is, what key challenges are you facing today? This is a multiple choice question, so please choose all answers that apply by clicking them on your computer screen. They are A, limited storage space for supplies, B, lack of visibility in inventory and supply management, C, issues with reimbursement, D, containing costs, or E, staff time utilization. Thank you, audience. So as you can see, facilities are experiencing a multitude of challenges in today's environment. Sheila, would you like to share your own list of challenges?
Certainly. One of our key challenges is a recent CMS ruling that clarified the definition of a hospital. It has had a big impact on us. We've already had one specialty hospital that has changed its standing to an ASC specifically because of the ruling. If you recall, in November 2017, CMS released the definition of a hospital requirement. Specifically, they are requiring that a hospital be primarily engaged in providing care to inpatients. CMS then defined an inpatient as being formally admitted, they must occupy a bed, and the care is expected to span at least 2 midnights, and that's where we have a problem. The majority of our patients are in good health with little or no comorbidities. As a result, our average length of stay is less than 2 days during the week, and we frequently do not have any patients on Sundays. The impact of the Chinese tariffs on supply expenses has been another key challenge. We focus heavily on expenses at NueHealth because our facilities are majority owned by physicians. They are afraid these tariffs will directly impact their bottom lines. That leads us to another and related challenge, cost containment. Beyond the impact of the Chinese tariffs on applicable products, we need to look at every opportunity to save. To do that, we need better spend information and we need to optimize data for each facility. This will help us make more informed purchasing decisions. It's really simple. Better data equals better price negotiations. And like many of you, Excel is our friend. So to obtain better data, we need to standardize our systems, policies, and nomenclature across all facilities. So it's easier to aggregate and negotiate better pricing with our vendors.
Thank you, Sheila. And John, would you share your key challenges as well?
Sure. Sheila mentioned the recent change in how CMS defines a hospital. They're using the patient's clinical status to determine payment rates, rather than another more appropriate measure such as time spent in the OR, in recovery, and under nursing care. In the future, we may have electronic health record systems that designate a clinical status for care and a different status for payment. In the meantime, we're seeing CMS bringing ASC rates in line with hospital outpatient rates, making the ASCs a more viable competitor to the hospitals. As payer changes impact revenue, the focus is obviously on cost containment and the productivity of our staff. Time utilization is key, as is the willingness of our physicians to change their office routines to accommodate our higher utilization of hospital operating rooms. In order to minimize costs, some physician groups have allocated block times to their physicians for clinic visits, while the other physicians are performing surgery. So we have to be aware of any unintended consequences due to changes in the hospital visits. Changing schedules can be problematic. Another challenge is the need for greater inventory visibility. It's hard to manage what you can't measure. And when you shine a light on one area, you see two other problems that need to be fixed. For example, because clinicians focus more on patients than cost, items may go unaccounted for and not be billed properly. I've had to make some large adjustments after doing physical inventory counts. So improving the inventory visibility will ultimately lead to both containing costs and improving charge capture, both of which will contribute to a healthier bottom line. By focusing on the inventory process, we found that the OR staff viewed zero charge items as unimportant and were more likely not to be charged. As a point of education, the OR staff were retrained to recognize that charging for items was a finance function and relieving inventory was an OR function. Then there's the challenge of standardizing processes. For a 9-bed hospital, we have 14,000 items in our charge master. It's really difficult to keep it up to date. Another issue is nomenclature. Different people use different terms for the same product. We need a common language for all products. That would facilitate physician preference card management, product substitution, as well as materials ordering.
Thank you, John. Let's move on to our next poll question, which is, for the panelists, how does your distributor help you address these challenges? For first, again, let's poll our audience, and then we'll hear from Sheila and John. This is another multiple choice question, so please choose all answers that apply. Options include conducts procedure pack reviews and optimizes supply utilization, provides data and insights to improve inventory management, identifies savings opportunities, optimizes storage space and supply utilization, and delivers actionable insights for continuous improvement. Okay, great. Thank you for your responses, audience. So now let's look and hear some answers from our panelists. Sheila, would you discuss how you work with your distributor to solve the challenges we've been discussing?
Yes, we're a lean operation, so we really need our distributor to be a dedicated resource to help us be more efficient and contain costs. And that's what Cardinal Health does for us, and that's important. If you understand the ambulatory surgery center world, you know that materials managers wear a lot of hats. They could also be scrub techs, rad techs, and often the safety officer. At NueHealth, we have monthly calls with our materials managers. On one of these calls, it was obvious that the materials manager was very distracted. I asked, is this a good time? If everything was all right? Turned out the materials manager was on the roof checking the generator. For the time they have available for managing materials, they now can work more efficiently. For example, we work with our distributor to set inventory levels and align with actual utilization. So our materials managers can order smarter and less often. Cardinal Health not only benefits us financially, but we've also built a strong relationship. We're always innovative and available when there's an issue to solve. At one of our centers, very strict covenants were recently put in place that restricted truck deliveries in the neighborhood. The new restrictions only allow for deliveries between 8 a.m. and 5 p.m., which isn't very convenient. Previous to the new covenant, our delivery was at 6:30. This change not only delayed our delivery, but also impacted our staffing. Cardinal changed the truck routes and helped us work with the township. As a result, we have allowed to have our delivery at 7 a.m., utilizing a less direct route. Bottom line, Cardinal Health is always looking for new ways to save us money and give us more resources to support patient care. I can't say enough about how they've supported us.
Thank you, Sheila. And John, how do you work with your distributor?
Sheila mentioned that NueHealth is a lean operation. As a 9-bed hospital, we have a small materials department, so we need daily deliveries. This ensures a level of inventory is on hand. We count on the reliability of those deliveries being daily. I don't want to get a call from a physician because of a missed delivery. That's why it's important to have a great relationship with your distributor, and we do with Cardinal Health, just as Sheila does. But supply chain issues have happened. Fortunately, one phone call to our Cardinal rep took care of it. That's when I realized someone else cares besides me. Given an opportunity, Murphy's Law is going to apply. So it's more important to me how the distributor responds than the fact the problem occurred. We're also fortunate to work with a distributor that provides additional services. For example, Cardinal did surgery pack reviews to help us standardize contents. This has improved our efficiencies, saved us some storage space, and lowered supply cost. Also, your distributor should help you use data to improve inventory management and lower cost. Physicians drive a lot of decisions at our facility, and they're scientists who live on data. If I'm making an emotional plea, I'm not going to get very far. But showing the cost and utilization data makes it a lot easier. We've used cost data when comparing products, such as biologics, to help align our physicians on preferred providers. It works.
Thank you, John. Moving on, our final question for the panelists is, what solutions are you using today to combat the challenges we've been discussing? So again, before we ask Sheila and John, let's hear from you, our audience. This is again a multiple choice question, so please choose all answers that apply. Options include PAC program, product consignment, data and analytics tools, product consolidation and standardization, and digital preference and preference card management. A couple more seconds here. Great. Thank you, audience, for your responses there. Sheila, would you share some of the solutions you use at NueHealth?
Yes. We leverage a number of distributor-driven savings initiatives. One was a rebate program called Go for 4. Each month, Cardinal Health representatives would present us with different savings opportunities for Cardinal Health branded items. There was never any pressure to buy them, but we exceeded our program goals, and we are now in Drive for 5 rebate program, which is bringing even greater benefits to our facilities. Go for 4 was based on a % of Cardinal branded spend compared to national or OEM spend. To receive the 4% rebate, we needed to achieve a certain percentage of Cardinal branded spend. We exceeded that goal very quickly, so the program was redesigned, giving us the opportunity to receive a 5% rebate and also standardizing our items. It would be very difficult to increase our current percentage of Cardinal branded spend even more, so that is why Drive for 5 is based on total spend. We must also keep our DSO, or days sales outstanding, down to net 30 or below. To help me quickly identify those facilities that might be at risk, Cardinal has created and sends me a report monthly, eliminating the frantic phone calls at the end of each contract year. Next, you need to access good information to make intelligent, informed decisions. And that's true whether you're a level 1 trauma center or an ASC that's open 4 days a week. So we collaborate with Cardinal Health to generate reliable data and do the deep dive analytics that improve decision making. 2 examples of the value of data and analytics is improving the accuracy of your preference cards and the charge master, and case costing by individual physician and by each of their procedures. Also, every month we create a data-driven scorecard that is customized specifically for each facility based on its PO spend. We benchmark their pricing against a national database and identify 10 opportunities for savings. Then one of the corporate supply chain directors has a monthly call with the facility to discuss these opportunities. And here's an example of our scorecard. And this is an actual scorecard for one of our facilities. I've removed the name and taken out all the dollar value just for confidentiality reasons. As you can see, it's a pie chart, so it's quick to identify how well the facility spend compares to the database. Green identifies those items where the pricing is at the lowest in the database. Yellow is pricing between the low and the median, and red represents those items purchased above the national median. We also have an overall score for the facility, and you'll see that on the right-hand side. Their score is 30, which is actually what our benchmark is and goal for all of our facilities to be at 30 or below. And then you can see an Excel part of that below are the 10 items identified for cost savings. We include the vendor number, manufacturer and manufacturer's number, as well as a normalized description. The last price paid, total spend over the last 12 months for that item, as well as the median price and a potential savings if the price was reduced. And then you'll also see there's a space for comments that we put in there during our call with the materials managers, just so that they can identify where they should be with the pricing and where we're getting our information from. We keep it simple, just to one page, and this information is also now included in the monthly board reports.
Thank you, Sheila. And John, would you like to share some of the solutions you use at your facility?
Sure. We have access to some data already and are now focused on increasing our data and analytics capabilities by utilizing an RFID tracking system to help improve the inventory visibility. Staff are now more conscious of the inventory and recognize that they're part of a larger process connected to materials management and to finance. It also helps that they know someone else is watching their actions. The tracking system also helps us optimize inventory management. The item utilization reports help us reduce stock and eliminate the out-of-date spoilage. Another invaluable solution for us has been our Surgical Services Committee, which closely evaluates new products for quality and cost savings. The members include physician owners, materials management, OR, and administrative staff. There's a good representation of the subspecialties on the committee, and their participation is a great help for managing vendor relations, particularly in the OR suites. I mentioned this before, but we also focus on creating new efficiency and cost savings by reviewing and standardizing our surgery packs.
Thank you, John. At this point, let's call on Jamie Kelly one more time to give us Cardinal Health's perspective on the challenges and solutions we've been discussing. Jamie?
Thanks, Molly. While ambulatory surgery centers, especially those that are independent, and large surgical hospitals are different types of facilities altogether, we've heard throughout this presentation that they share some common challenges. By working with the right distributor, we believe facilities can arrive at some common solutions, such as optimizing procedure packs to standardize items, reduce the amount of storage space required, and help contain costs, optimizing their supply chain to reduce complexity and variation while also improving efficiency and lowering costs, continually introducing new cost savings initiatives, and finally using data and analytics to shine a light on opportunities to improve efficiency and cost.
Thanks, Jamie. So as we wrap up our discussion today, I'd like to once again thank Sheila, John, and Jamie for sharing their experience and insights. I'd also like to thank you, our attendees, for your attention. So please take a moment to complete the survey that will pop up as the webinar concludes. Your feedback is really invaluable in helping us continually improve the value you receive from the discussions such as this one. We'll now be happy to answer your questions. So the first question we have here is for you, Sheila, and it is as follows. I work at a small 2OR ASC with very little data integration. In fact, our preference cards are handwritten. What would you suggest is the first step to improving the accuracy of our preference cards given the lack of data we experience?
That's a very good question, and it's critical that your preference cards are accurate if you're to capture your case costing. I would start by collecting and recording all of the supplies used during a procedure. That's a lot of work on the front end, but it's well worth it. There's a couple ways you can do this. One way is to keep all the open packages at the end of the case, kind of pick through the garbage, and compare it to what's on your current preference cards. Or you can have somebody sit in the back of the room keeping track of everything that is used. I'd piece out the work, maybe pick one procedure or one physician to start with. If there are no resources available, Cardinal may be able to help you. They have a clinical team that could come on site to look at ways to drive waste out of the OR. There are RNs who work as scrub nurses and or surgery leaders with extensive product knowledge. They'd also be able to give suggestions that would bring more efficiencies to your facility.
Thank you, Sheila. The next question we have is for John. John, the question is, you mentioned your surgical services committee. At my AAC, I find it sometimes difficult to get all the necessary stakeholders aligned when it comes to product changes. What advice do you have for me and my team to get on the same page?
Another good question. Generally, there are three things that drive decisions regarding OR products. The physician's personal preference, which can be based on the feel of an instrument or the ease of the application, the cost of the product, and its clinical efficacy. Of the three, doctors generally put clinical efficacy first, and then it's a contest between cost and personal preferences. It's not uncommon for the doctor wanting an item to put personal preference over cost and to have all the other doctors put cost over his personal preference, especially in a physician-owned facility like ours. I would say there's no magic answer. Just look for a superordinate goal that all can support and focus on that.
John, thank you for that insight. Sheila, I'd like to direct this next question to you. I've never had a deep relationship with my distributor. How would you suggest that I make the first ask of them to get more involved in my business and operations to help me identify cost savings and efficiency opportunities?
I think the first thing that I would do is increase your communications with your distributor. And an easy way to do that would to have scheduled quarterly business reviews or QBRs. I always would have these meetings in person, and they should cover your fill rates, freight charges, on-contract, off-contract spend. Reviewing your off-contract spend will help identify potential cost savings. To review your purchasing efficiencies, look at the average lines per PO and the percentage of POs that are submitted electronically or on their website. Unless we review how many times we create 1- and 2-line orders, we don't realize how often it happens. Having the distributor provide year-over-year trends also helps provide insight to both cost savings opportunities and improving your purchasing efficiencies. During a QBR, I always ask for additional information or homework, so that is something that I use when I start the discussion at the next QBR.
Thanks, Sheila, for sharing your response there. John, it looks like we have time for one more question, so I'm going to steer this one your way. It is, I know my ASC can have better inventory visibility, but we don't have a system in place that helps us. What is a small win I can implement tomorrow that will help my team have more visibility into our inventory?
As Sheila mentioned, preference cards are really important. I'd suggest that all preference cards be reviewed and updated on a regular basis. This gives staff and physicians the opportunity to think about product utilization. At the same time, it generally triggers a review of the charge master. Another thing is for an OR staff member to monitor OR charges on a daily basis. Make certain that all items being used are being charged for. One last step, to keep everyone on the same page, someone outside the OR should be monitoring the OR processes for accuracy and timeliness. This can be done by someone in medical records, utilization review, clinical documentation, or the business office, depending on your organization. Of course, all this is easier said than done.
Thank you, John. So that is all the time we have for today. I want to thank our presenters, Sheila and John, for sharing their insights today, and to Cardinal Health for sponsoring today's webinar. We look forward to having you join us for future programs.